Hi everyone, I am Dr. Andi. It is time for today's Facebook Live. While I give all of you the opportunity to log on and join us today, I'll give you a brief background and introduction into who I am, and a little bit about my practice before I launch in and start answering all of your questions. So I am a naturopathic physician. I have been practicing in Toronto, Canada for about 12 years now, so it sounds a long time every time I say that. My focus really started more so on sports medicine. Initially, I was a dancer, I was a personal trainer, and then I slowly transitioned more into sort of metabolic nutrition, hormone replacement, and in our practice, we focus, we have sort of three streams. We have a longevity stream, focusing on regenerative medicine, anti-aging. We do a lot of peptide therapies, things like that. Then we also do a lot of the hormone replacement. And then we also have a stream where we focus on chronic unexplained illness, chronic fatigue, fibromyalgia, chronic pain, Alzheimer's, preventing and reversing cognitive decline. And really at the foundation of all of our protocols or all of our care is really that low carb keto standpoint. I personally have been keto for over 10 years now. That was sort of my own personal health journey that took me along that route. So I ended up gluten and dairy free, and I kind of stumbled into keto and sort of did more research in that point and then introduced that into my practice. And then slowly as that sort of evolved in my personal life, I started introducing it to my patients. And then of course, we were able to start introducing exogenous ketones. So that was a really big change as well for patients, for those who really aren't able or weren't able to follow a ketogenic diet, or those who weren't able to stick to a ketogenic diet. Exogenous ketones are really helpful, or even to optimize the diet for patients who are already keto. So I'm a good example of that. I was already keto. I do what I call cyclic keto or sustainable keto, which is that I sort of cycle in and out of ketosis, which you can do. Once you've sort of transitioned or moved into nutritional ketosis already, you can cycle in and out. So that's sort of how I follow. That's how I follow ketogenic diet, and then I add in the exogenous ketones as well throughout my day. I do a lot of intermittent fasting, so I drink ketones sort of in the morning in that fasting window, and then in the afternoon if there's a little bit of an energy dip or before a workout. Then I'll often add in ketones there as well, just to sort of help fuel the day. And so I'm using it more to optimize, again, my sort of diet changes. So I get a lot of people asking, I think a lot of people get overwhelmed initially when they start to research the ketogenic diet. I just had a conversation sort of at a dinner the other night, a Christmas party, where somebody said that they were, following a ketogenic diet and they just couldn't eat all that fat, all the bacon and cream and things like that. And so people get lost a little bit in some of the things that you can Google, and it's not necessary to really go down that route, or go down that path of having to do the really high fat in that way. So I do modify it a lot for my patients, but for those who are not ready to transition to full keto, then I will often, just introduce exogenous ketones, introduce fasting, and then get the diet changes going from there. Okay, I can see all of your questions starting to come in now. So let me get started. I will try and answer all of them. Sorry, I will try and answer all of them. And if I miss them, I will go back and answer what I can. Okay, so you're supposed to drink a lot of water when you're following a ketogenic diet, but when you do that, you find that your sodium levels will bottle out. So you're supposed to drink water, but really what I want patients to consume when they're following a ketogenic diet or taking exogenous ketones is to actually make sure they're consuming enough electrolytes. So it's not just a lot of water I'm wanting them to take. I want to make sure we're replenishing minerals. The diet and the exogenous ketones can act as a bit of a diuretic. So it's not just water. We want to replace some of those minerals. So get your Mitoplex, mix it in with your water or with your ketones, and so make sure you're getting those minerals in. I will generally, for people who are new and just transitioning, have my patients right off the bat start by taking magnesium, electrolytes, and a multi or a B complex. So having people put those electrolytes in kind of right off the bat is something that I ask them to do to prevent some of that dehydration. What is the MCT oil used for? So quite a few different things. Depends on how you want to incorporate it into your day. Some people like the MCT oil specifically because it can help to accelerate some fat loss. I really love the MCT oil, using it in the fasting window if you're intermittent fasting. So for intermittent fasting, the way I do an intermittent fast is I want my patients to do 16 hours from dinner until their first meal the next day. So doing that at least 5 days a week if possible. And some people struggle to kind of make that 16-hour mark. You're sleeping through most of it, but some people struggle a little bit to make that whole 16-hour mark. I do really like the MCT oil in that fasting window. Provides a little bit of energy, a little bit of brain fuel, and also keeps you full. Adding the MCT oil does not break the fast. That's a bit of a misconception as well. So people are a little bit concerned that if they add that in, that they will break the fast. What we're doing in that fasting window is turning on autophagy, so that process of clearing out dead, damaged cells. And so what we have found in that fasting window is that beta-hydroxybutyrate will also optimize autophagy. But what actually shuts autophagy off is a spike of insulin. Insulin is triggered by carbohydrate consumption. So when you consume something like an MCT oil, it doesn't spike insulin. It's not going to shut off the fast. So it's absolutely fine to have MCT oil in that window. You can have water, you can have coffee without sugar in it. So you can absolutely do that as well. It's not going to break your fast. And then somebody asked about unsweetened almond milk breaking the fast. So again, you just have to check the sugar consumption of what it is that you're having, if they put in any additives, because it's the sugar that will spike the insulin and shut off autophagy. So I sometimes put a little bit, I actually put pure coconut cream in my coffee in the morning, and then a little bit of butter. I love my buttered coffee, so I'll do pure coconut cream from the can and butter. So I find that that's really nice as well. And that, again, that's not going to break your fast because of the fast. There's not a lot of sugar in there. And I do allow ketones in the fasting window as well. Because again, what we're trying to do is encourage the production of ketones to get some of the benefits of the fasting. So beta-hydroxybutyrate will really just optimize what we're trying to do in that window anyway. How many ketones a day can I drink? You can actually drink quite a few. I drink 1 or 2 a day, and that's usually what I get my patients to start with, is just drinking it. Right, just sort of once a day as a start, but you can drink a lot of ketones in a day. The concern is often diabetic ketoacidosis. That cannot happen if you have insulin in your system. So the only people who would need to be concerned are those who are type 1 diabetics, or those who are late stage type 2 diabetics who are taking insulin. And so those individuals would have to make sure that they're controlled diabetics. They're monitoring their blood glucose and their blood ketone levels. But on average, I think the last time we did the calculation, you could take up to 40 sachets in a day with no problem. So I mean, you'd have to consume a lot of ketones to get anywhere close. To a level that sort of wasn't safe for you. You don't have to drink a whole box of ketones in a day. Once or twice is really all that you need. Depending on the goal or the outcome that you're looking for, if there's a therapeutic outcome, then often I'll have my patients do a third one in a day. It really just depends what we're doing. But if you're new, you're just starting, just once a day in the morning is really the easiest way to get going. So I wait about 4 hours after my levothyroxine before having ketones. Is there an amount of time I should wait before taking the rest of my supplements? So you can take your other supplements with ketones. That's no problem. There's not generally an interaction there. Again, it depends on what you're taking. So you can always do sort of an interaction checker. It depends what you're taking, but you can take your supplements with your ketones overall. You do have to take it away from your thyroid medication. We know that thyroid has to be taken on its own, but you can absolutely take the rest of your your supplements in it, with it, and that's not a problem. How to figure out if there are cherries you have an allergy. So I would just read the label very carefully and see what the ingredients are. If you are concerned that something is an extract of cherry or something like that, then just contact support and they can give you a full breakdown of really where all the ingredients are coming from. But just read the labels very, very carefully. Again, if you have an allergy, so I do get that question a lot. Some people will say they have sensitivities to either some of the sweeteners and things like that. So if you do have a sensitivity, there's not much, or an allergy, there's not much you can do about that, because obviously you can't change the formulation overall. So you just have to see if you're able to tolerate everything that is in there. Does coconut cream break a fast? So no, pure coconut cream doesn't. So I do a tiny amount of pure coconut cream in a can. And then some of the artificial sweeteners can also be used during the fast if they're not spiking insulin. And when I say artificial sweeteners, I mean more like erythritol, xylitol, things like that. Not aspartame. I don't recommend aspartame just for some of the toxicities of that sweetener in general. So I don't recommend that overall. The artificial sweeteners can actually stimulate overeating, kind of tricks your brain into thinking that you're sort of still hungry. It kind of overrides our pathway, that feedback mechanism. Some of them are also neurotoxic and they cause us to eat a little bit more. So I ask people to avoid aspartame and things like that. But again, something like stevia, or erythritol, xylitol, those are better sweeteners. Can you add MCT oil directly to your ketones? Yes, absolutely. You can add them directly to your ketones. You can add your Mitoplex directly to your ketones as well. You can absolutely mix your ketones with other things, and that's not a problem. So you can mix it all together if that's a little bit easier. Can you use other supplements? Can you use other supplements with your ketones? Yes, you can, for sure. I always recommend other supplements. I always say it's important to remember that exogenous ketones aren't going to fix all of your medical conditions. There are other things that you might need to address. There are other things that might need to be balanced. So people are usually on more than just ketones. And so yes, absolutely, you can use other supplements with them. When I start my patients on exogenous ketones or on a ketogenic diet, right off the bat, as I said earlier, I'm having my patients start magnesium, a B-complex, and a multi, and electrolytes as well. And that will also sort of prevent any keto flu that some people might experience if they're new or sort of just transitioning. So I find that that's very important, very helpful. So again, important to remember that the ketones are not going to fix all of your medical problems. And so yes, often additional supplementation is required. It just depends on what your goals are and what it is that you're treating. Is MCT safe for the liver? Yes, very safe for the liver. So is beta-hydroxybutyrate as well. It's very safe for the liver. A lot of people have concerns, and I'm always curious where the concern about liver health comes, where that comes from or comes into play when we get the question about, is beta-hydroxybutyrate safe for the liver, MCT oil? Yes, they're perfectly safe. Obviously, things get broken down and processed through the liver, but they're not going to cause any harm, any damage. There's a lot of misconception about MCT oil overall. So there's a lot of misconception about the ideas of consuming fat. So fats have been demonized in the same way as sodium was in the past. So yes, absolutely, you can take MCT oil. There's no harm or damage that it's going to cause to the liver, and there are a lot of other additional health benefits to it as well. Can use hydrocodone and use ketones. It doesn't need to be spaced out. So 2 answers to that question. The first is that I don't know why you're on that medication, so you have to make sure that your health professional or your health provider says that that's safe for you to take in conjunction with the different additional supplements and with your ketones. So make sure that you talk to your healthcare provider about that. And when it comes to being on any other types of medication, I'm always encouraging and recommending that my patients take them away from other prescription medications. So just to be on the safe side, give yourself a little bit of time. Give yourself some time in between the medication and the ketones once your healthcare provider has said it's safe. The question about cherry allergy, again, I did answer that a little bit earlier. So just to contact support, just to ensure, again, you can read the label, but if you want to make sure, depending on how severe the allergy is, that there are no extracts or anything like that, then contact support and get a really good breakdown of all of the ingredients. You're not trying to kill her by not knowing. Nope, you're not. We don't want you to do that. So that's not what we're trying to do. So just, again, contact support if you want more information on each individual ingredient to make sure nothing is extracted from cherries. Again, I don't know the degree or the severity of the allergy, so you have to work with the person who wants to take it, and then they need to work with support so they can decide if that's something they could take a lot. Ketones and corn allergies. So same thing, when it comes to an allergy, there shouldn't be any issue with a corn allergy. But again, if you're concerned and you want to make sure and verify, then I do recommend contacting support. And then you can go through all of those ingredients and sort of the raw source and things like that and make sure that that is safe for you. When you're drinking ketones, you have to follow the ketogenic diet. No, you don't. So that's really one of the primary benefits of taking exogenous ketones, is that you don't have to follow the ketogenic diet to get the benefits of having that BHB in your system. And so that's one of the greatest things, is that when some people are just not ready to transition to a ketogenic diet, you're able to drink the ketones, that beta-hydroxybutyrate, and it puts you into nutritional ketosis as if you're following a ketogenic diet. And so this is how we get that benefit. So you do get the same, that same benefit. Obviously, if you pair the ketogenic diet with exogenous ketones, the benefits are even greater. But you absolutely will get, benefit if you're if you're taking exogenous ketones and not following the diet specifically. So what about penicillin? So same thing with medication. You have to check with your healthcare provider, make sure that they say it's safe for you. Again, most medications are safe, but you have to ask your doctor, make sure they've done sort of a drug interaction checker, and then just take them away from each other. We deal with patients with a lot of chronic illness. Many of them are on penicillin. There's not really any issue, but your healthcare provider has to tell you that that's safe for you to take. Is it normal to get a headache when drinking ketones? Or am I missing a step? What should I do not to get a headache? So if you get headaches when you're drinking ketones, usually that's a sign of a mineral deficiency. A lot of people are magnesium deficient, and it's often that loss of magnesium that is causing some of that. I saw someone just comment more water. It's not necessarily more water. It's usually more minerals. It's the electrolytes that you're missing. And so I was mentioning a little bit earlier that when I have somebody start exogenous ketones or a ketogenic diet, I want them to start taking electrolytes and a magnesium supplement. That's, again, to replenish some of those minerals that you may have lost. The beta-hydroxybutyrate, again, can act as a bit of a diuretic, so I want my patients to sort of replenish some of those minerals that they might lose. Many people are mineral deficient already, so I will often say that the diet and exogenous ketones sort of let us know what we're deficient in general. So it's often that we need to replenish more magnesium, replenish those electrolytes, and that will help with with any headaches that you might experience. So somebody was asking again, what type of magnesium? It depends on what I'm trying to get my patients to do, but usually I recommend magnesium chelate, threonate, or glycinate, not usually citrate, because has much more of a laxative effect. But usually one of those three, depending on what it is I'm trying to address. What about while I'm pregnant? Is it okay to drink ketones? So you have to work with your healthcare provider. Every pregnancy is different. So right off the bat, I would say you have to work with your healthcare provider. Ketones are approved for adults 18 plus, and of course we're going to say sort of not pregnant at that time. So your healthcare provider has to say that that's safe for you. I'm currently obviously expecting. I do take ketones. I have had ketones through my whole pregnancy and breastfeeding. I did the same with my first baby as well. But that's something that was safe and that worked for me. So you have to find out with your healthcare provider and with that specific pregnancy, and if that is safe and right for you. Okay, so why would your GFR change after 3 months of ketones, and your creatinine levels as well? So there shouldn't be any negative impact on kidney function overall from the ketogenic diet. So I would say you need to just work with your healthcare provider if you're mapping and tracking blood work to find out if there's anything else. A lot of those levels can fluctuate. Dehydration can cause some of those levels to fluctuate as well. We know that that beta hydroxybutyrate has been shown to be beneficial to kidney health in general. I know I talk a lot about sort of the latest nephrology conference that my nephrologist actually attended, and the topic there was the ketogenic diet, exogenous ketones, and how that's beneficial to kidney function in those undergoing dialysis. So I would say talk to your healthcare provider. You have to see if something else is going on. There shouldn't be any detrimental impact to your kidney function in general from taking exogenous ketones. So I think that you need to just work with your healthcare provider and see what might have caused some of those numbers to change. My cholesterol went up doing keto. The LDL and overall triglycerides went down. Good cholesterol went up. So that's actually a good thing, because you're asking, is there anything you should change to bring the cholesterol down? But if your LDL and triglycerides went down and your good cholesterol went up, that's actually what we want to see. So I don't actually think there's something that you're needing to change to bring those values down. Also depends on how soon you are checking those values. So usually when people switch to a ketogenic diet, I suggest giving about a 6-month period of time before checking cholesterol again. Often adding in some of those healthy fats, those cholesterol levels will come up and then come back down. So you do have to give your body a little bit of time to adjust and adapt to some of the new sort of dietary changes that you've been introducing. But again, overall, we want to see the HDL, good cholesterol, go up. We want to see LDL, triglycerides go down. So that's actually a good balance and a good shift. The reason your total cholesterol went up is because your HDL and your good cholesterol went up. I think it's important for people to remember that cholesterol is not always bad. Dr. David Diamond has some really great presentations on that, just some really great presentations and information on cholesterol in general. We have this idea that cholesterol is a bad thing. It isn't always a bad thing. We need cholesterol to make hormones. And so often what I'll do with my patients when we see elevated cholesterol is you want to find out if it's good or bad cholesterol. So there are many more investigations that you can do. There's a much deeper dive that you can do if someone's LDL has gone up. You can do a much deeper dive to find out, well, what kind of particles of LDL are you making? Are you making light and fluffy ones? Are you making heavy, dense ones that are blocking your arteries? Have you had a carotid ultrasound, a CT angiogram? There are a lot of other things that you can do to assess your cardiovascular health to determine if your cholesterol is actually a problem or not. So I think it's important to understand that cholesterol is not always a bad thing. There are a lot of other investigations that we can do to determine if that, how to manage cholesterol. It's not always getting on a medication, bringing those levels down. And again, give yourself a really good period of time just to see, to allow those levels to come up and to level out. But again, if you feel that those levels are too high, it might be that you need to modify your diet a little bit. Following a ketogenic diet doesn't need to be, 70% fat. I'm doing a little bit less fat than that with my patients. And I'm also having patients eat more of the sort of healthy plant-based fats. I'm not having them do like the dirty keto that we call it. So it's not bacon and cream all day long, but it's lots of avocados and olive oils and things like that. And so that's generally how I'm having my patients follow the diet. So yes, you might see a fluctuation, but those levels should come down. When drinking the pruvic ketones in the morning, can you also drink ketones in the evening? Or can you drink anything ketones? Sorry, I'm not sure I understand that question entirely. So I guess you're asking if you have it in the morning, can you have it in the evening? So yes, you can. You can have more than one serving in a day. So no problem having ketones in the morning, and then you can have it again afternoon, evening. So I touched a little bit earlier on how many servings you can have in a day as well. Plant-based cheese, no, you don't have to do plant-based cheese. I'm not a huge fan of the plant-based cheeses. A lot of them are soy-based. So with the cheese, I'm fine with patients just having normal cheese. I usually make my patients do keto dairy-free, or I should say cow's milk-free. So I'm having patients use more goat and sheep milk. So like pecorinos and things like that. Goat cheeses. So yes, you can definitely have cheese, avocados, olive oils. That's usually how I'm recommending, but I'm not usually recommending, tons of bacon, heavy creams and things like that. And I find that that's often something that deters people from the diet because it's so heavy. And you can only follow that for so long before it feels really, really heavy in your system. So I usually encourage people not to follow the ketogenic diet that way. Okay, so I think that is all of our time for today. This time always flies by on Wednesday. Always one of my favorite times of the week to connect with all of you, to provide some education, answer your questions. If I missed any, I will go back and try and answer if I missed any of your questions today. But thank you so much for joining today, everybody, and stay safe, stay healthy.